Hello everybody and welcome back to my channel. As promised, today we're going to be talking about a lot of issues that go on after delivery, whether normal vaginal delivery or if you went through an operation, the cesarean section. So these issues have been coming up from patients we've had and from friends and relatives, and I thought it wise that if I do this video, it may help a lot of us. So the first issue I'm going to be raising is about nipple cracks. A lot of women experience nipple cracks after delivery, and it usually comes as a result of breastfeeding. So when you're breastfeeding, maybe you're not breastfeeding rightly, you can have a nipple crack. Now, if you're not positioning, if your baby is not in a good position, you're going to have this nipple crack. So the entire nipple is supposed to be in the baby's mouth. That is going to help you to prevent any cracks. Now, if that nipple is not in the baby's mouth, the baby is going to be biting on the nipple itself, and that is how you can have wounds on it or sores. So you're going to try to avoid any of this from happening by making sure that you're carrying the baby in the best possible position and all of the nipple is in the baby's mouth. Yeah. However, if it happens that you have a nipple crack, what do? There are a lot of native beliefs or other forms of treatment that friends or relatives most especially will bring up. But most importantly, you're supposed to keep your nipple clean at all times. You could have a crack on one side and the other is free. That is very good. But what happens if you have cracks on both nipples? What do? Does it mean you stop breastfeeding? Definitely no. You will not stop breastfeeding, at least for now. So what you can do, or it will also depend on what your doctor advises you to do, depending on the level of the crack you have. He may give you medications for pain because it is extremely painful. It is extremely painful. He may give you medications for the pain. Then he may give you some prophylaxis antibiotics, like antibiotics to help that the wound on the nipple does not get infected, just to help with that. Now, to prevent this, you're going to have to, some people use a nipple shield. So a nipple shield will just, as the word goes, a shield. It's a shield. It's going to shield the nipple, but the baby is sucking on the nipple through using the nipple shield. So the baby's mouth is not directly on the wound and is not making the wound worse. The shield will be there to protect the nipple. So you can use that while waiting for your nipple to get healed. So you have the nipple shield, or you can use a gel pad that can be very soothing. You use a gel pad. Some people use breast pumps. You can use a breast pump. It's also advisable so that you can express this milk out. Either you use a breast pump or people just use their palms and press the thing out and it comes out for some people. But using the breast pump is best, or you use a nipple shield and you wait for that nipple to heal. You hear a lot of people telling you, keep on giving the baby. As long as you're giving the baby, the wound is going to heal. There is no way that you have a fresh wound and the baby keeps on putting the mouth there and you're expecting it to heal as fast as possible. No. So you're going to either use a shield to help, or you will use a breast pump while giving the baby while letting the baby eat from the other breast here. So those are the things we can do to help us either prevent or to help us manage nipple cracks. However, if it's so bad, you can consult with your medical doctor while taking all these precautions. Now, our second point is going to be about how long do you wait until you can start having sexual intercourse with your partner after delivery. This is a very tricky one, not very tricky anyway, but this is a tricky one because there is no defined period. However, we're going to advise you to wait for 6 weeks if you had a normal vaginal delivery. This 6 weeks is because we expect that after 6 weeks, everything has gone back to normal. The size of the womb or the uterus, your cervix is back to normal, your vaginal wall, everything down there is back to normal. So 6 weeks is the ideal. But if you have stitches, if you had some tears and you were sutured, you probably have to wait longer. We're telling you to wait not because we don't want you to get back into your normal activity, but all of this is because there are a lot of changes that go on during the pregnancy, and immediately after delivery you have a lot of pain. Maybe you had no tears, you may have bruises, and they will pain a lot. So the act in itself is going to be very, very painful. Your vagina may be very, very sore, and all of this will still lead to the pain. We will not want you to have any postpartum hemorrhage. We don't want anything that is going to go and provoke any infections. So for this period, we will be hoping that you avoid these activities, so that after 6 weeks, when we're assuming that everything is back to normal, you can engage into your normal activities. Also, immediately after delivery, there's a hormonal changes that go on. Your estrogen level drops, and it can even drop to before the pregnancy period, and this is going to cause your vagina to be dry. So the act of sexual intercourse in itself may not be pleasurable during this period. So this is just like a guide to follow. And as I said, if you have stitches or you had a tear, you will want to wait longer for the wounds to get healed. If you had a cesarean delivery, the hormonal changes will still be the same. You have a dry vagina, and the act may not be as pleasurable as before. Also, you may want to wait for your scar to be healed, to be properly healed before you're doing anything, because you're going to have abdominal pain from the surgery. So these are just precautions to take, and we don't want any infections, and we don't want any bleeding. So that is the advice I can give with regards to this issue. The third issue will be postpartum blues. So postpartum blues is like the road to postpartum depression, where you have you're very moody. At times you're happy, at times you're sad, and this is just like 2 to 3 days after you have the baby, and it can go up to about 1 to 2 weeks, but it's supposed to resolve after 1 to 2 weeks. You're just moody. At times you look at the baby, you're so happy, oh my God, I cannot believe this is my child. Later on you're like, oh Jesus, how can I take care of this child? I'll not be able to take care of this child. You just go down. So this is actually normal for about 80% of deliveries, especially after your first delivery, sorry. So there are a lot of women that will go through this, but they don't want to believe that this is what is happening. If it's happening, it is normal. And what happens, at times you may look at your baby and you're asking, is this my child? You don't feel that bond, but it's supposed to go down after 1 to 2 weeks. However, if this kind of mood swings, and not having a bond with the baby, and not wanting to eat, not being able to sleep, if they persist for more than those 2 weeks, you should make sure that you have a consultation. Even before, if you feel that the symptoms are severe, you can have a consultation and make sure that you're not getting into a depression, because all of these can lead to a depression. But if it's going to happen from 2 to 3 days after birth to about 1 to 2 weeks, when the baby is like 1 to 2 weeks old, and it ends there, then you just had postpartum blues. And I repeat, a lot of women go through it. About 80% of women go through it. So you should not be scared or feel like you're a bad mother for not feeling all the nice things immediately after you have the baby. Now, you're asking yourself, why me? Why is this happening to me? It's not happening to other people. Pregnancy in itself is a very stressful period for any woman, and the delivery too. The delivery in itself is also very stressful. So you're coming out of this, and you're having a lot of hormonal changes that will cause all this to happen. So having family by you, friends to support you, is going to make this really bearable. And you're hoping that after these 2 weeks, everything goes on. But as I said, if it does not subside after 2 weeks, you should get a consultation and make sure you're not getting into a postpartum depression, because that one can kill. And about 20% of these women that have postpartum blues are going to end up with postpartum depression. So we just have to be really careful and make sure that we are on the right track. Now, the fourth, and definitely not the least, is about the time management. After you have your baby, and I'm repeating, especially for first timers, people with 2 3 children may have become used to used to having children around and all, but after your first delivery, yeah, maybe you're not really aware of just how time consuming and stressful it may be, especially if you're alone or you don't have so many people to help you. um, your sleeping pattern is going to be disturbed because babies cry at night. They will cry at night. If your baby does not cry at night, that's good for you. But if your baby cries at night, what do? You have to try and make sure that if the baby is sleeping, you are sleeping, because you need rest. You need rest. That rest is very, very important. So you discover that your whole routine, the routine you've had, maybe you're having your first child at 24 or 23, the whole routine you've had for about 23 years is just going to be disrupted because you have a child crying every 2 to 3 hours or waking up every 2 to 3 hours to eat or to feed. So it's not going to be very, very easy, but you have to make up your mind and you have to be ready to accept all the help you can get, accept all the help you can get, so that some other person can carry the baby and let you rest. This issue with the time and the baby being around is also going to have an impact on your sexual life with your partner, because you just have an extra person there that needs all the attention. So you have to discuss with your partner about this new the new circumstances that are going to be unfolding and how you guys can go through it. So there'll be a lot of communication that will be needed. One other thing is that whether you had a tail or not, you're going to have painful urination for most people, because during that delivery there's a lot of the baby causes a 10 centimeter head passing through your vagina, so it's obvious that you have a few bruises. So don't be scared if you go to pass out urine and it is very painful. It's going to pass after a while, but there's no alarm there. So I hope it's been very helpful. I hope so. And with this, we can be able to better plan our after delivery or our postpartum period to suit our lifestyle. If you're a working mother, if you're home all the time, so that you can arrange and make sure that the impact of the baby does not change almost everything in your life. Thank you very much. Thank you very much for listening. And as always, if you have any questions or any comments, please write them down in the comment section. Subscribe, like, share, and encourage me. Thank you. Have a nice day.